Hey, this is Jennifer Christie coming to you from our field office here in Zionsville. And as you can see, I am the only one here today, and that is because our volunteers and our staff are working remotely due to the coronavirus. And so we still need your help. We need volunteers. You can go to jenniferforindiana.com and sign up to volunteer. We have ways to connect you to get involved, and you can do that even from your home. And so we are hard at work, but we're just not working in the office because we are respecting that social distancing. That is something that is recommended by the CDC at this time. And so you won't see us at the doors as much this weekend, but we are hard at work and we ask for your help too. You can also donate on our website, jenniferforindiana.com, and we can use your donations as we fight for important issues like climate action, healthcare, common sense gun reform, education, and so much more. So I want to take you to an important area of our office. And of course, the coffee maker is very important, but I want to draw your attention over here. Okay, so this is a life-size version of Buzz Aldrin. And Buzz Aldrin, as you probably know, is one of the first human beings to ever put his footprint on the moon. And we launched our campaign on the 50th anniversary of the day that we put the first human footprint on the moon. And we chose that date symbolically. We chose it because if we could accomplish that, then we can accomplish whatever we put our minds to. You know, we sent people to the moon, and more extraordinarily, we brought them home safely on less technology than the phone that I'm recording this on. I have more technology in my phone, as do you, than the entire Space Administration had at that time. You know, they took these individuals and put them on the moon and brought them home safely on 64 kilobytes of RAM. Isn't that astonishing? And so I'll also draw you to a really interesting piece of trivia. The only image of Neil Armstrong on the moon is in the face mask of Buzz Aldrin. He took a lot of the pictures and therefore did not have a lot of pictures of himself. And so you can see the only image of Neil Armstrong in the face mask of this image. So if we can do this, we can do anything. We can solve climate change. We can solve our healthcare problems. We can do so much if we put our mind to it. And so today I want to talk to you about healthcare because we are in the middle of dealing with the coronavirus. And if there's anything we've learned from this, it is that we are in this together. The healthcare of your neighbor matters. The healthcare of your coworker matters. It matters not only to those individuals, but it matters to you and it matters to your family. It matters to me and it matters to my family. We are in this together. You know, I want to be very clear. I am the only candidate in this race to explicitly support a Medicare for All bill. And I'm not being wishy-washy. I'm telling you, I support the Medicare for All bill. And I support it on a number of grounds. First, I support it because I believe wholeheartedly that healthcare is a human right. That means that it belongs to every man, woman, and child as a human right. The World Health Organization said this in 1947, that healthcare was a human right. And it's time that America lived up to that. I also believe that there are economic reasons why we need to support Medicare for All, as well as reasons for freedom. So let's talk just for a minute about healthcare as a human right. You may know the story about my mother. My mother passed of cancer, and she was a nurse who worked her whole life caring for sick people. And when she got sick with cancer, the first thing that happened was that the insurance companies dropped her. They dropped her, and she fought cancer without insurance. And she spent the last year of her life worrying about keeping her home. Now, unfortunately, this is not an uncommon story. I know what it's like to be the family that is fighting to keep their home and fighting for the life of a matriarch of their family. My mother was very important to me and to many people around her. She was surrounded by people who loved her, and yet she told me she felt so alone. And that is because she spent that time worrying about bills in her final year of life. And this is such a common story. We have half of our country living paycheck to paycheck, and countless people, millions, tens of millions of people who are one medical catastrophe away from losing their home or financial ruin. It is wrong, because healthcare is indeed a human right. And if we started treating it that way, this story would become less common. The other reason why I support it is because it is about freedom. It is about you being able to go to the doctor of your choice. It is about returning the decision making to the doctor and the patient instead of the insurance company and your employer. Right now, you are constrained to go to the healthcare choice of whatever your employer can afford to get to you. And you have limited options depending on where you are employed. You also are constrained by the choices that your insurance company is willing to approve for you. In a Medicare For All system, we are talking about a system that eliminates copays, deductibles, and premiums, and allows you to make the decisions for yourself instead of depending on a third party to do so for a profit. And so I support it for freedom. Imagine if you could work where you chose, you could live where you chose, you could do all of that because you were guaranteed health care as a human right. That's why I support Medicare for All. Imagine if that your health care was not a bargaining chip on the table, and instead we could talk about really raising wages at negotiations rather than trying to negotiate over health care, which you would already be guaranteed. That's why I support Medicare for All. I also support it for economic reasons. We are already seeing that we have spent $1.5 trillion that the Fed injected into the economy in order to try to save the stock market. Just over the past few days, we are seeing that we're needing to pass a bill, the Family First Coronavirus Bill, which does do some really good things. I think it could go further to guarantee additional insurance for people who might be laid off and free testing. But I think we could go further. Imagine if we had had a universal healthcare system in place prior to dealing with this. So I want to break some basic numbers down for you. One of the things that I did prior to running for Congress was I worked in clinical trials, and I was a master black belt. And basically what that is that is a process improvement person. And master black belt is the highest certification that you can get in the field for that. And I did that for over a decade. And so what I did was I made processes better. I saved money, I made things more efficient, and I did that all over the world. And so I want to break down some basic numbers. If you look at these Centers for Medicare and Medicaid, it's cms.gov. You can get a lot of this data. So I just want to kind of put all of this in perspective, because one of the biggest questions we get is, well, how are you going to pay for it? Well, let's put it in perspective. The total healthcare costs, complete healthcare costs in this nation are about $3,600 billion. It's big. Private insurance costs private insurance is spending $1,243 billion of that. Out-of-pocket costs are $376, prescription drugs $335, and then Medicare plus Medicaid are $1347 billion, and these are all in billions of dollars. Okay, and you can get this data on cms.gov. So when I look at efficiency, I'm looking at this very top line right now, so it's not a full efficiency. Let's put this in greater perspective, because one of the things that we know is that the United States spends more per capita on healthcare than any other nation in the world. Quite frequently, your prescription drugs or your treatment costs 2 to 4 times of what it does in other countries. Okay, so let's pull out some top level numbers and look at this. That $3,600 billion is the total current cost. Let's take out 50% of what private insurance is paying towards that. That would assume a 50% efficiency improvement. And I think that that's about what we would get, if not more, through a Medicare for All system. The out-of-pocket costs would go away, the 376. The prescription drugs, we know that prescription drugs here are at least twice as much as they are everywhere else. If we assumed only a 40% efficiency, we could take out $134 billion for that. And then if we got a 20% efficiency on the current Medicare and Medicaid system, by streamlining that, 20% is just pretty much what you can get from improving any process. That is around 269 billion. So just top level efficiency, we can look at this number and see that it is really more like $2.2 trillion. That is a lot different. That's about a 40% improvement, just top line looking at this. So this $3.6 trillion really isn't the story. When you look at efficiencies, it's more like 2.2 trillion. And we already collect 1.1 trillion already in Medicare taxes. That's already paid for. Leaving $1.1 trillion that we need to guarantee a universal health care system to every man, woman, and child as a human right. Our government just found a way to inject $1.5 trillion into the economy as a result of the coronavirus. This is a question of priorities. It is a question of treating healthcare like the human right that it is. I'm Jennifer Christie, and I approve this message.